Traumatic brain injuries are the signature wound for post-9/11 veterans and service members, and associated injuries, like post-traumatic epilepsy, haven't seen a decline in prevalence in many years. This lack of progress gives a clear example as to why it's important for researchers to address the topic of veteran brain health. This summer, our team developed a needs assessment to determine how best to engage with veterans on the topic of brain health. To make this project happen, we created a team with a variety of backgrounds, and I'd like to share some of their thoughts. Kirk Hauser leads the community organization we partnered with, the Veterans Breakfast Club, and is a veteran himself. His knowledge of the veteran community has proven invaluable and has helped us understand some veteran motivations to engage in research.
Some of the veterans have personal questions about war, about life, and they also have an interest in education, research, and the dispensing of information beyond themselves.
As Kirk describes, there is a curiosity about research from the veteran community. We want to turn this interest into actual research engagement. However, research with veterans has the potential to be challenging due to a divide between military and civilian cultures. We believe we can overcome this through the implementation of community-engaged research. Another of our team members, Jeni Hunniecutt, is a veteran and researcher at the Chez Veterans Center. Because Jeni is a member of both communities, she has an understanding of how to make interactions between these two groups successful.
Building trust and rapport, veterans are the military is a very closed off institution. It's an institution in and of itself. And so people that are part of that, when they get out, building trust with, cultural outsiders can be difficult. So as scientists wanting to go into these communities and do research with these veterans, we have to build that trust and rapport, and direct, clear language and communication is definitely one of, if not, the most important way to do that.
Another priority of ours is making sure data collected in this research is relevant and impactful. Erin Anderson, an engineer and postdoc researcher at the Carle Foundation Hospital and Beckman Institute, has brought extensive knowledge on this topic to our team and highlights some of those practices.
Because resources are limited everywhere you go, everyone is trying to make the most of whatever resources they have available to them, whether it's directly money or it's subjects or it's access in any sort of way. You're trying to scale across groups as much as possible. So the more that you can find commonalities between groups that are doing similar things, you tend to be able to strengthen your research as well.
By working in this collaborative environment, we have all learned a lot about how community engagement in veteran-related research can be beneficial. The needs assessment we created will serve to tell us how best to establish long-term research engagement with the veteran community for future studies. We're optimistic about the integration of more community and stakeholder engagement in research, and believe it will make veteran needs known, give the veteran community the platform to create positive change in research from study planning to dissemination, and contribute to better outcomes for those in the veteran community. Thank you again to my amazing team for this opportunity, as well as everyone at IHSI and a part of the Community Academic Scholars Program for making all of this possible. I'm looking forward to sharing the results of our needs assessment and formalized plans for veteran engagement in the near future.